Welcome everyone to this video on my technique for total knee arthroplasty. This is designed for the trainees on my rotation so that they can come in prepared and we can further your training during my rotation. So my philosophy is to have a reproducible evidence-based technique for knee replacements. We are publishing our results at present. Currently for my TKR, I'm using Striker Triathlon cementless cruise sheet retaining ASM navigated knee with no patella resurfacing. My philosophy is adjusted mechanical alignment cuts on both femur and tibia side with defined boundaries. Pre-op planning, I like to have skyline views for all my pre-op x-rays, long leg alignment views for patients with severe deformity, which is common. Look for posterior osteophytes as that changes your extension gap as you remove them intra-op. And look for patella baja so that you're prepared to do more extensile releases to get the patella out of the way. In terms of positioning, I like to have feet of the patient over the edge of the bed, so you're operating from end of the bed, and ipsilateral hip to be flush against the edge of the bed as well. I use a ladder for knee flexion positioning. My incision is done in semi-extended position. I do a limited fat pad excision, enough to allow anterolateral tibial edge visualization. For my distal femur cut, we're aiming for 4 degrees of flexion to allow for precision saw flexibility, aiming to take away 8 millimeters of the distal femur to match the implant. In some cases require 8.5 or 9 millimeters, depending on the degree of fixed flexion. In terms of varus and valgus, of course, starting off with 0 degrees, checking the difference in cut between medial and lateral side, and aiming to be 5 millimeter difference at the most, and adjusting the varus and valgus angle to achieve this. My restriction is 4 degrees here. So this is the part where we're doing an adjustment to our mechanical alignment. This significantly reduces our soft tissue releases, and we're publishing this as well. My proximal tibial cut is very similar, 4 degree slope, aiming for 8 millimeter depth. Quite often it's less in a flexible knee, or if there is significant medial or lateral wear, so medial and lateral wear. Adjust the varus and valgus angle to achieve 5 millimeters or less differential between medial and lateral sides. Overall aim in terms of balance for me is to achieve a knee that's nice and tight and stable in extension. Patients like this as they want absolute stability when they're weight bearing. Aiming for 2 millimeter laxity in flexion. And similarly, you need to be tight and extend, so tight medially and with slight 1 to 2 millimeter laxity laterally. I would encourage you to read around the concepts mentioned, including the ones not mentioned, ask questions during the rotation, and I look forward to your training.